When we talk about losing fat, most of the time, what we are actually talking about is what we eat, how we eat, and what kind of food that we should be consuming rather than exercising. Yes, exercise does play a role in accelerating your fat losing progress, but without a proper and controlled diet, it's the saying that you are probably never going to see your abs. According to the survey done by Insider, a sister publication of Business Insider, towards more than 1,000 people regarding their New Year's resolutions for the year of 2019. What they have found out is that 119 millennials between the ages of 18 to 29 said that their resolutions for 2019 are related to dieting or eating healthier. It is, therefore, clear to see that some of us do struggle a lot when coming down to executing a dieting program. To solve this issue, I have done some research on the internet regarding the diets which are very popular currently among people who are trying to lose fat. According to a survey done by Insider, two of the most popular diets in 2019, without any doubt, are low-fat diet and ketogenic diet. Low-fat diet is a diet which contains less than 30% of daily calories coming from fat. The reason that this diet is well known among those dieters is due to the fact that 1 gram of fat has more calories compared to 1 gram of carbohydrates or 1 gram of proteins, so it's easier to reduce the calories intake since a very small amount of fats being taken out from a diet can make up such a huge difference. Several studies have also backed this diet up as a diet that helps people to lose weight. One of the studies investigated the effect of reducing total fat intake on body weight. The result is, undoubtedly, saying that diets lower in total fat were associated with lower relative body weight. With that being said, according to Jennifer Fitzgibbon, a registered dietitian at Stony Brook Hospital Cancer Center in New York, he mentions that when too much fat is eliminated in a diet, it can cause serious health consequences to a being as our body requires a good amount of fat to keep our organs, systems, and even skins to stay in good conditions and make sure that they are well functioning. Ketogenic diet, on the other hand, has gained lots of trust from dieters, especially in Western countries. Ketogenic diet is a diet that requires you consuming very less amount of carbohydrates but higher amount of fat, in which the carbohydrate consists of 5 to 10% of daily calories intake, whereas fat consists of 70 to 80% of daily calories intake. Basically, ketogenic diet reduces the carbohydrates intake and replaces it with fat. The reduction in carbs puts your body into a metabolic state called ketosis. When this happens, your body starts to use the stored fat as energy for your daily activities. It turns fats into ketones in the liver, which also supplies energy for your brain. In this diet, food that are high in fat and proteins are recommended, such as ham, cheese, bacon, salmon, or avocado. Food that are high in carbohydrates, such as sugary food, grains, fruits, and etc., on the other hand, are strongly forbidden. Though lots of similar kind of studies have shown positive results on the effect of ketogenic diet towards one's health and weight loss, and even several studies have shown that it is even better when comparing to low-fat diet, as it might be due to the fact that consuming high amount of protein and fat are more satiating. There are several drawbacks that one might encounter when he or she decides to stick with this diet. First of all, entering ketosis at first would lead you to several side effects, ranging from headache, weakness, and irritability to constipation, nausea, and vomiting. This is due to the reason that your body has been using carbohydrates as a fuel for so many years that it doesn't expect a sudden change into using fat as a fuel to happen. In other words, it's a result of your body adopting ketogenic diet. Second, ketogenic diet is not meant for everyone, especially for those who have high blood pressure, diabetes, or other chronic conditions. It's always better for you to consult your nutritionist or doctor at first before trying out ketogenic diet. So here comes to the key of dieting, which is better, ketogenic diet or low-fat diet. Well, none of them is better than the other one. This is due to the reason that we should know that any kind of diet works when coming down to losing fat, if and only if the calories in is lower than the calories out. Therefore, it does not have any difference whether you are sticking with the low-fat diet or ketogenic diet, if our main concern here is of losing weight other than the health condition. More often, it's all about personal preference. You can stick to whatever kinds of diet that you want if you think you can get along with it for the rest of your life whenever you are trying to lose fat. A good diet should consist of longevity. Stick with a diet that you are comfortable with, and most importantly, that suits your surrounding and condition well enough. I personally recommend that sticking with the roots of dieting, Calories in lower than calories out works the best for most of us as there is no need for any kind of restriction. It's simple, yet found to be the most effective one. Thanks for your watching.